Good morning, everybody. My name is Shahram Sharif. I'm the Chief Executive of Liva Healthcare. Liva Healthcare is a digital health company. Our mission is to reverse and prevent chronic diseases such as diabetes type 2 and obesity. Just at a glance, we have been around since 2015. We're currently a team of about 120 people across 3 countries, Copenhagen, office London, and Berlin. Served customers across 12 countries. We have currently 3 treatments commercialized for diabetes type 2, prediabetes, and obesity. And we work with customers both in public health as well as life sciences and private insurance companies. To date, we have raised about $25 million. So basically, we develop digital therapeutics, which are basically software as a medical device to treat, prevent, and manage diseases, and we augment them with behavior science-led health coaching. Unlike many digital health companies, we are strongly rooted in science and have a lot of clinical evidence for our treatments. And we are used to deliver outcomes as a service. We own the outcome of our treatments, and we're used to work within a value-based healthcare model. Just quickly on burden of chronic disease, I'm sure many of you know it. Today, 1 out of 3 people worldwide are suffering from a chronic disease, so that's about 2.2 billion people. And in the next 7 years, there are about 500 million more going to be added to it. And according to WHO, this is consuming about 80% of all total healthcare spending. If you look at the 5 leading chronic diseases, this is costing about $2 trillion a year. Now, what is really interesting is that 80% of all chronic diseases are driven by lifestyle factors, such as diet and exercise and other habits and behavior. And that is where we are focused on. So our mission is to focus on lifestyle-related chronic disease and go for reversal beyond just managing them. So simply put, our solutions consist of just 2 components. One is a technology platform, and another one is actual human coaching that is scalable using the technology platform. Essentially 3 components: a patient-facing app, which is used when patients are onboarded into our programs to collect their data and track their progress and allow them to interact with our clinicians and health coaches. Health and clinician dashboard that basically tracks the progress and sees all the data from the patients and the members, and the analytic element and an engine which basically crunches all the data using machine learning, artificial intelligence to further personalize and optimize the treatments to the patients. Taking a deeper look, there's a lot more under the hood. I'll not go into all the details, but we are really keen on using behavior science, certified coaches, and use the technology platform to make it scalable. We use AI and data analytics to continuously improve the outcomes and personalization and make coaches more efficient in what they do. When it comes to technology, we're not just deploying technology for the sake of technology, but our continuous efforts are around finding the sweet spots to get to the best possible outcomes at scale. There are many studies that shows that if you apply more human element coaching, because it's all about behavior and habit change, you will have better outcomes. However, that is not scalable. On the other side of scale, if you use a lot of technology, that's very scalable, but the outcomes are poor. So we are really in the sweet spot of the right mix between technology and human coaching. As mentioned earlier, we are driven by clinical evidence, and our outcomes are very attractive. So we are showing engagement rates up to 80%. So patients stay on our program up to 9 to 12 months. We have shown 80% decrease in HbA1c for patients with diabetes and prediabetes, 47% remission of prediabetes, and up to 39% of patients with diabetes type 2 completely reversing their chronic conditions, off medication, all that. Those are significant results, both in our RCT studies and even better outcomes in our real-world evidence. Currently, we are covering about 40,000 lives. We have millions of minutes of video interaction with our patients, with our coaches, which we use, as I mentioned earlier, through machine learning to optimize the treatments. We have applied more than 400,000 treatments to our members to date, and we're one of the top providers of NHS in the UK. in a value-based contracting model. We are ready to scale our commercial achievements. Just as an example, in NHS, which is one of the toughest markets to get into, as some of you might know, we have shown over the last couple of years that we have been able to increase our market share by almost 3 times. We have increased the part of the members who choose for digital versus traditional face-to-face treatments by a factor of 3. And by applying more and more technology, we have made the whole unit economics significantly more efficient by a factor of 2.5. And all of that has shown significant growth for us commercially. In terms of commercial growth and expansion, there are basically 2 elements. There is the therapeutic areas that we cover that we are expanding. So we have currently in the portfolio, beyond the 3 commercialized treatments for obesity, prediabetes, and type 2, we are currently working on additional treatments that will come out in the next 2 to 3 years with different partners, which give us access to additional almost $300 billion in addressable market. Another expansion axis is to expand through different markets. To date, we have done pilots across 12 countries, which has given us a lot of information for different markets. Currently serving reimbursed markets and life science customers in Scandinavia, UK, Germany, and Benelux. And we have plans to expand that to 10 additional markets across Europe, Middle East, and Australia in the coming few years. We are currently raising a 15 million round to help us accelerate our growth to go from 3 million annual recurring revenue, which we are at today, to break through the 50 million revenue in the next 4 years. We'll be profitable within the next 2 to 3 years. We have a very strong revenue diversification across 3 or 4 different customer segments: public payers, private insurance companies, life science players, and retail. As mentioned earlier, expanding to 6 therapeutic areas beyond the current 3, and covering lives from 40,000 today to about 600,000 in about 4 or 5 years. I'm here today representing our company, which is active in Europe. Why I'm here? Because I believe there is a tremendous opportunity for US investors. Hopefully some of you are here in the room. Because we believe there is a massive underinvestment in digital health across Europe versus US when you look at the market potential. So the digital health market is larger in Europe compared to US. It's growing faster in Europe compared to US. Yet, if you look at the total investments done in 21, it's almost 1 on 4. So we believe there's a significant opportunity for US investors to invest in European companies like ours. Quickly about the team. This is my 3rd company in Medtech and digital health space. I was actually here 3 years ago pitching for my previous company, which we sold last year in cardiology. Very excited to be here again. Executive team consists of our COO and the CFO, who are all serial entrepreneurs, having done scalings across different industries. We are backed by key investors in Europe, mostly. One of them that might be known is Athos, which is a family office in Germany, who are the same investors behind Medtech. So they've done pretty well, and they are backing us into our next round. So thank you for your attention. Feel free to reach out to me for any discussions or conversation we could have to find a potential fit. Thank you.